Imagine being poor, forgotten, living in rural Alabama in the 1930s. Then the government arrives with a promise of free doctors, free meals, and free treatment for a dangerous illness they called bad blood. For 600 black men, most of them sharecroppers who had never seen a doctor in their lives, it felt like a miracle. This wasn't a treatment program. It was a secret, non-therapeutic experiment called the Tuskegee Study of Untreated Syphilis in the Negro Male. The doctors weren't there to heal. They were there to watch, to take notes, to chart the gruesome, decades-long progression. The men were given placebos, fake pills, ineffective ointments. They were subjected to painful and deceptive procedures like spinal taps, which the doctors lied about, calling them special free treatments. For years, the men suffered, all while the doctors meticulously documented their descent into blindness, insanity, and heart failure, calling it science. Then, in the 1940s, a true miracle happened. Penicillin was discovered and became the standard, effective cure for syphilis. The doctors of the Tuskegee Study knew about it. They had the cure in their hands, and they did nothing. They actively conspired to keep it from the men. They ensured their names were kept off draft lists so they wouldn't be treated by the military. They made a deliberate choice to let them die. The consequences were catastrophic. Dozens of men died directly from syphilis. Many infected their wives, who in turn passed congenital syphilis to their children, creating a second generation of victims. The lie continued year after year, decade after decade, a dark secret held by the U.S. Public Health Service. It wasn't until 1972, a full 40 years after it began, that an Associated Press reporter blew the story wide open, exposing the horrifying truth to a shocked nation. The public outrage was immediate and overwhelming, and the study was finally shut down. Years later, an official presidential apology was issued, but the damage was done. The Tuskegee Study left a deep and lasting scar, shattering the trust between the medical community and the African American population for generations. It remains one of the most infamous and unethical studies in history, a